This women's multivitamin is a combination of vitamins and iron that helps to treat or prevent vitamin deficiency caused by a poor diet, certain illnesses, or during pregnancy. Vitamins and iron are essential for maintaining good health and are important building blocks for the body. It is recommended to take this medication daily as directed by your healthcare professional. The best time to take this is usually with a meal to help with absorption. Be sure to follow the dosage instructions provided on the label or as directed by your doctor. It's important to take this women's multivitamin by mouth, usually once daily or as directed by your doctor. Make sure to follow all the directions on the product package and do not take more than the recommended dosage. It's best to take this medication on an empty stomach, about 1 hour before or 2 hours after meals, with a full glass of water unless directed otherwise by your doctor. If you experience stomach upset, you can take this medication with food. However, avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after taking this medication because it may decrease its effectiveness. Remember not to lie down for at least 10 minutes after taking the tablets or capsules. If you are taking the delayed release form or extended release capsules, swallow them whole without crushing or chewing. Take this medication regularly at the same time each day in order to get the most benefit from it. If you experience constipation, diarrhea, or upset stomach, it is usually temporary and may go away as your body gets used to the medication. If these effects persist or worsen, contact your doctor or pharmacist. Iron in the multivitamin may cause your stools to turn black, which is not harmful. Your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of side effects. Many people using this medication do not experience serious side effects. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed, contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Accidental ingestion of iron-containing products is a common cause of poisoning in children under 6 years old. It's important to keep women's multivitamins out of the reach of children. If overdose occurs, seek immediate medical assistance or contact a poison control center. Before starting to take women's multivitamin, it's important to talk to your doctor or pharmacist if you have any allergies to its ingredients or any other allergies. Some brands may contain inactive ingredients like soy that could cause allergic reactions, so it's important to discuss this with your pharmacist. You should also inform your doctor or pharmacist about your medical history, especially if you have iron overload disorder, a history of alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, make sure to tell your doctor if you have a vitamin B12 deficiency before taking it. Folic acid may affect certain lab tests for vitamin B12 deficiency without treating the anemia, which could lead to serious nerve problems. It's important to consult your doctor for more details. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, it's important to consult your doctor before using women's multivitamin, as it may pass into breast milk. Now let's talk about how to use women's multivitamins. It's important to be aware of any potential drug interactions that could affect how your medications work. This product can decrease the absorption of other drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's important to separate your doses of these medications as far as possible from your doses of women's multivitamin. If your multivitamin also contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. This medication may also interfere with certain lab tests, so be sure to inform lab personnel and your doctors that you use this drug. Always consult with your doctor or pharmacist before making any changes to your medication dosage. If someone has taken too many women's multivitamin tablets and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. It's important to take the recommended daily dosage and not exceed it to avoid any potential overdose. Always consult with your healthcare professional before taking any new medications or supplements. If your healthcare provider has recommended this medication, do not give it to anyone else. Make sure to attend all your medical and lab appointments. Certain brands might also have additional ingredients like docusate. If you have any questions about the ingredients in your specific brand, make sure to ask your healthcare provider or pharmacist. It's important to remember that this product is not a replacement for a healthy diet. It's always best to get your vitamins and minerals from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your healthcare provider. If you forget to take your women's multivitamin at the scheduled time, take it as soon as you remember. However, if it's close to the time for your next dose, then skip the missed one. Do not take a double dose to make up for the missed one. Take your next dose at the regular time. It's important to store women's multivitamins at room temperature, away from light and moisture. Avoid storing them in the bathroom and make sure to keep them out of reach of children and pets. When it comes to disposing of women's multivitamins, do not flush them down the toilet or pour them into a drain unless directed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.